There is a common assumption that the most dangerous part of any surgery happens while the scalpel is actively at work. But for many patients, the highest risk of physiological collapse occurs during the volatile transition of waking up from general anesthesia. In the summer of 2017, actress and musician Selena Gomez experienced this crisis firsthand. At just 24 years old, severe organ damage caused by lupus forced her to undergo an urgent kidney transplant. The procedure itself was grueling. A standard kidney transplant takes about 2 hours, but Gomez's surgery lasted 6. By the time they closed the incisions, her biological systems were heavily traumatized and highly vulnerable. The organ had been donated by her close friend and roommate, Francia Raisa, who made the ultimate physical sacrifice to get Gomez through the operating room and into the recovery phase. But the recovery phase is where things went wrong. Gomez woke up and tried to rest. Suddenly, she started hyperventilating. Her body gripped by immense pain, she began frantically grinding her teeth in a state of sheer panic. Something entirely invisible to the naked eye had failed. An artery had twisted inside her body, choking off the blood supply. It was an immediate, life-or-death internal crisis. This is exactly why emerging from anesthesia is so perilous. The patient is largely incoherent, unable to articulate the disaster happening inside their own body. To survive, they require an invisible, technological net to catch them before they crash. That technological net is called the Post-Anesthesia Care Unit, or PACU. This room is a highly controlled environment, completely reverse-engineered to translate invisible biological distress into immediate, actionable data. The primary early warning system for a crisis like the one Gomez experienced relies on vital signs monitors. On this screen, real-time data and waveforms track a patient's vital signs. If an artery flips, the monitor instantly detects a sudden blood pressure drop and a rapid heart rate spike. Secondary numbers indicate blood oxygen saturation, a critical metric for catching respiratory failure. Because heavy anesthesia chemically weakens the respiratory muscles, patients often struggle to breathe on their own. Oxygen therapy and mechanical ventilators step in to provide immediate physical support, preventing the organs from suffocating. And if physical fluids or secretions block the airway, medical staff utilize portable suction machines as a crude but highly effective failsafe to clear the throat. Every piece of this frontline technology serves a single purpose: converting the abstract, silent symptoms of a failing body into a loud, precise language that medical staff can react to in seconds. Beyond tracking alarms, the PACU aggressively manages systemic trauma. Infusion pumps are programmed to safely deliver precise, continuous doses of pain medication and fluids, keeping the central nervous system from spiraling into shock. Another silent threat is postoperative hypothermia. Anesthesia disrupts the body's ability to regulate heat. If a patient's core temperature drops below 96.8 degrees, the healing process stalls and infection risks rise. Specialized forced air warming blankets are applied to manually force the body temperature back to baseline. Because the patient is entirely immobile, blood can pool in the legs and form lethal clots. To counteract this, pneumatic compression devices are wrapped around the limbs, rhythmically inflating and deflating to artificially pump blood through the veins. Even the furniture is an active medical tool. An adjustable hospital bed allows nurses to elevate the legs to drain severe swelling, or raise the upper body to physically open a struggling patient's airways. The architectural design of the room also acts as a passive medical tool through large-scale daylighting. By flooding the space with natural light, the design aligns the patient's internal circadian clock with external time. This resets the body's natural sleep cycles, which helps calm a panicked nervous system and prevents the disorientation common after deep anesthesia. And if all of these preventative measures fail, every PACU is equipped with an emergency crash cart. It sits heavily stocked with defibrillators and resuscitation drugs, ready for a worst-case scenario. The modern recovery room is a highly engineered life support ecosystem. Every machine, bed, and window is positioned to preempt disaster from every possible angle. Because Selena Gomez was enveloped in this monitoring net, her crisis was caught immediately. The PACU equipment translated her panic and pain into hard data, alerting the medical staff to the anomaly of her flipped artery before it was too late. That rapid, data-guided response allowed doctors to rush her back into an emergency procedure, repair the artery, and save her life. The success of the transplant quickly became evident. In the immediate aftermath, Gomez's blood pressure completely normalized, and the severe arthritis caused by her lupus disappeared entirely. This chart highlights the staggering statistical success of her procedure. Today, thanks to the transplant, there is only a 3 to 5% chance of her lupus ever returning. The beeping and humming of PACU equipment serves as a continuous, vital data stream between an unconscious patient and their clinical team. This technology gives a voice to a silent body, anchoring the recovery process in real-time metrics and establishing a stable, data-driven path back to life.